Hello, my name is Angelica Buffaloe, and today I'm presenting the paper Characterizing Opioid Overdoses Using Emergency Medical Services Data, a case definition algorithm enhanced by machine learning. Okay, so Um, the problem is that fatal opioid overdoses are increasing in the United States. At minimum, there are tens of thousands of overdoses that occur every single year. With this paper, they examine how creating a case definition of opioid overdoses and applying a machine learning algorithm can help identify non-fatal overdoses and even predict future cases. What is the purpose of addressing this problem? So, according to the World Health Organization, opioids are compounds that are extracted from the poppy plant, as well as semi-synthetic and synthetic compounds with similar properties that can interact with opioid receptors in the brain. Opioid medications are usually prescribed to treat physical pain, but they can be highly addictive, and often people misuse them because they provide a sense of euphoria. Legal prescriptions of opioids include hydrocodone, oxycodone, and codeine. Hydrocodone is more of a pill, so is oxycodone, and codeine can be in liquid form. Illegal opioids include heroin and fentanyl made outside of medical settings. As an outsider, I've seen a lot of fentanyl related deaths. Um, I've seen that increasing, so it would be interesting to research this in 2025 or in like recent years because this study was based 10 years ago, over 10 years ago. Um, Going back to misuse of opioids, it can be deadly because it slows down the part of our brain that regulates our breathing. So some signs of opioid overdose include unconsciousness, difficulty breathing, pinpoint pupils, which are just like really tiny pupils, and your skin can turn pale with blue or purple fingernails. Um, in 2018 specifically, in 2018 specifically, 70% of nationwide drug-related deaths were caused by opioids. And that same year in North Carolina, there were five opioid overdoses a day, totaling in 1,700 deaths. So five overdoses a day, 1,700 deaths. Obviously, as I mentioned before, it's an epidemic. So we should address this problem. Risks that lead to a potential opioid overdose could be taking opioids by injection. So that's often done with heroin. It can also be done with fentanyl. It could also technically be done with pills, but I don't know the process of that, but I've heard that it can be done. Also combining opioids with other substances such as alcohol, benzodiazepines, or stimulants. Mixing any type of medication is not good, but definitely with opioids, like it can be deadly. Taking more than the prescribed recommended dosage, that can also lead to overdoses. If you were to stop taking opioids and then resume after a long period of abstinence, that can cause an overdose. Having any pre-existing medical conditions that are physical or mental, so someone who has mental health challenges that can cause overdoses, or even physical ones like if someone has HIV or liver problems or cancer, those can also lead to an overdose. Also, taking illegal opioids that are not prescribed by medical professionals. So, Even though fentanyl can be prescribed by medical professionals, a lot of the time, illegal drugs have illegal amounts of fentanyl in them, mixed in them. So that's definitely something that I've seen recently that can lead to overdoses and have led to fatal overdoses. So, important properties of this problem. The research is important because machine learning can help identify patterns in opioid overdoses and even highlight factors that may increase the risk of future overdoses to occur. Um, so, just finding out what causes overdoses to occur and what can um, medical professionals and policymakers do to stop future overdoses. Finding this information could help medical professionals, policymakers tackle the epidemic. Some measures that they could potentially enforce are increasing monitoring of prescriptions given and the availability of opioid dependence treatment centers. So I feel like if there were opioid dependence treatment centers, maybe there would be a decrease in overdoses because people would have the resources that they need to get help, get sober. Um, but without the research, that can't happen. So this is why this study is important for that. Methods used. So the methods used in this study were was data from the National Emergency Medical Services Information Systems version 2, specifically in North Carolina from January 1st, 2010 to December 31st, 2015. So this study was 5 years long. It focused on patients aged 12 and older and that resulted in 6,210,572 encounters, which is a lot of encounters. But some patients could have had multiple overdoses. This is not saying like 6 million people, it's just 6 million encounters over that 5-year period. Some variables of interest include the reason for the emergency call, which the researchers labeled as chief concern, dispatcher notes, which they labeled as dispatch concern, medication administration. So, if a patient was given medication that reverses overdoses, which is naloxone, Narcan, that's the primary medication that can reverse an overdose. Primary and secondary impressions of first responders. So those are just some variables that they were interested in. Now, with this chart, at the top right, we can see that there was a total of 7,284,860 encounters in that 5-year study. Um, as the flowchart goes down, we can see that there are many things that are excluded. There are a lot of exclusions. So once we get to the bottom where it says encounters for patients over age 12, we're only left with 6,210,572. So there were almost a million, if not a million, excluded. Um, Yeah, so after several exclusions and specific guidelines, we can see at the bottom 5 categories were created. And this is what's going to qualify in the study. Um, so at the top left, we have our training model, which I will get into in the next slide. But after excluding from the 7 million, we are left with 6 million, and we exclude even more. So as the chart goes down, we see that we have 52,000 left after encounters are consistent with overdoses as the chief concern. When we exclude even more, we're only left with 1,500, with opioids as a chief concern, and 2,400 with encounters of non-opioids as the chief concern. So, based on this chart, I've realized that relying solely on naloxone data isn't reliable because um, there were cases where EMS gave a patient naloxone, but it wasn't considered an overdose. Like they were having a different medical emergency. So they had a category of where patients under 40 were considered for the study because most cardiac arrests are most likely overdoses in people in that age range. Descriptions of architecture. So, as I mentioned before, out of the 7 million, 6 million were used to train the machine learning model. Researchers extracted encounters where the chief concern was listed as an overdose and mentioned the word opioids. So, this resulted in only 52,000 encounters. Also, as mentioned before, non-opioid related overdoses were also included to train the model, and data was split into an 80% training and a 20% testing. After training, we are left with 3,968 cases. 1,508 of those cases were opioid overdoses, and 2,460 were non-opioid overdoses. So there were more non-opioid overdoses, which was I found interesting. So after the researchers got this data, they organized the encounter notes in R and created a corpus. It was mentioned that they cleaned their text by making everything lowercase, removing punctuation, changing naloxone to Narcan, um, changing opioid slang terms to just simply opioid, fixing the extra spaces in the notes, and they also kept the stop words so that the data is easier to understand. And I thought that was interesting because with working with stop words in this class, it's always told remove the stop words, but sometimes stop words are useful, so I found that interesting. They also created a data frame with the tidy text package and used a one word per narrative per row structure to eliminate sparsity and make the data more user friendly. So their primary goal was really to make this user friendly, make it easy to work with because it is 5 years worth of data. And as mentioned before, there are millions of encounters. So anything to make the data easy to work with was prioritized. So there are two variables that were created from ranking the words in the EMS notes by their scores. The highest positive weights were words most linked to opioid overdoses. For an example, like if the word Narcan was in the notes, most likely someone had an opioid overdose. And comparatively, the lowest negative weights were words linked to non-opioid overdoses. Researchers used a classification tree to predict whether each case was an opioid overdose. They didn't provide a visual on that classification tree, and I thought that would have been interesting to see, but no visual and nothing else really said on it. To test the algorithm further, the researchers tested it on a random sample of 50,000 EMS notes. So, of course, with individuals over 12, 48,000 samples were left to work with. After applying the algorithm, only 397 potential opioid overdoses were identified. And since this was such a small number, the researchers had a nurse actually review this information by hand to confirm that this was correct. Researchers also ran a sample against a case in Rhode Island to compare the overall number of opioid overdoses identified by both definitions, their degree of overlap, and their positive predictive value. So in the Rhode Island case, North Carolina had a case definition by using rules and machine learning, but Rhode Island only used those rules. So they both ended up having a high positive predictive value, but North Carolina found 134 more cases, and it has to be because of the machine learning. Um, so this just goes to show that yes, you can still have a high positive predictive value, but it's more useful to use machine learning along with general rules. So the results of the North Carolina case, the model produced performance metric averages of 97.6 specificity, 95.8 positive predictive value, 93.7 accuracy, 92.7 negative predictive value, 87.4 sensitivity. 52,000 opioid overdoses were reported, with 30,000 of those being considered unresponsive. So that's a lot of unresponsive overdoses. Out of the 30,000 unresponsive overdoses, 83% received naloxone. So that's great. The figure to the right describes the characteristics of patients seen by EMS. It says who received naloxone, who didn't and had an opioid overdose, and who had an unresponsive overdose. And something that I found interesting is that it was mainly white males in urban residences. So, as we can see at the top of the chart, like with naloxone administration, opioid overdose, unresponsive overdose, males dominate that. Females are not far behind, and then unknown is much lower. But yeah, females are not far behind. When it comes to race, though, like white white individuals, they really dominate this. Um, Following whites are blacks, Native Americans, Native Hawaiians, Asians, and then some with information that we don't know. Um, and it's mostly in urban areas, so that I kind of find found interesting, but it makes sense. I guess my assumption would have been that it was maybe more in rural areas, but yeah, 29,000, 33,000, 19,000 across the board for urban residences. Um, and yeah, I found that interesting. So, there were some trends that were found in the study. During the study, unresponsive opioid overdoses actually increased from 3,412 to 7,191 encounters. Opioid overdoses followed in a similar trend, and so did naloxone, but it eventually leveled out. So, these peaks and dips on the line chart, the line graph, those are just the monthly rates. And the straight line is just the average of those monthly rates. So we can see that opioid overdoses are still pretty high. The naloxone follows behind it, and then unresponsive overdoses are is the lowest out of the three. So this is another graph that shows trends that were found, but in this one, this graph shows that more patients actually refuse naloxone which I thought was really interesting. And I'm not really sure why that is. They didn't mention why that is. But a positive is that there are fewer unresponsive opioid overdoses, so that is great. But it's just interesting that naloxone is the lowest out of the three. Um, I would assume that people will want to receive the naloxone, but apparently not in this trend. So, in the study, there were some limitations that were mentioned. Overdoses were being counted wrong, as I mentioned earlier, with the flow chart. Some overdoses, you can't heavily rely on naloxone because EMS may think that someone's having an overdose, but it's actually a different medical emergency. So overdoses were being counted wrong. Patients who skipped EMS or received naloxone elsewhere weren't counted. So in the chart earlier in the previous slide, we saw that there are people who just refuse naloxone, which is so interesting. And there are companies that actually give out free naloxone to everyday people like me. So sometimes you don't need to wait on EMS to administer it if there's a situation where you have to. So that is a limitation. Earlier records were missing notes, which is understandable. The model might work differently for different groups of people. Researchers could not fully check for accuracy when comparing to the Rhode Island case. And also, results may vary with newer EMS data since this data is older. As I mentioned at the beginning of the presentation, I would really love to see this model be used on data today since the opioid epidemic is just getting worse. So, yeah, I would love to see that. So, to conclude, this study showed that combining rule-based methods with machine learning can improve how opioid overdoses are identified in EMS data. When comparing the number of overdoses to naloxone administration, it is found that naloxone use was level while overdoses continued to rise. This tells us that relying on naloxone data alone isn't reliable. The methods used were flexible and can be applied to EMS data systems across the country. By using machine learning to detect keywords in EMS notes, medical professionals can better track overdose trends and support preventative efforts. So yeah, I think that more this type of work needs to be done more because, as stated before, this is really an epidemic, and um, would love for policymakers and medical professionals try to find a way to slow this epidemic down. So overall, I did like this paper study and the methods that were used. With the ongoing epidemic, it's important for researchers to find the most accurate approaches in measuring opioid overdoses. Using machine learning can help read and interpret EMS notes, which can give medical officials a clear picture of the issues and trends over time. This could help in preventative work. The only thing that I would have liked to see in this paper is the classification tree that predicted whether each case was an opioid overdose. Um, I really like visualization, so the other visualizations were nice when showing the flow chart of like encounters that they were going to use and that had to be used, and then also the trends that they found. But yeah, I would have really liked to see a visualization of that classification tree. So yeah, I would have really loved to have seen this be applied to data today. It seems like every year especially when it comes to celebrities. I don't personally know anyone affected by the opioid epidemic, but I have seen on the news like famous people who have passed from this, and it's just really getting out of hand. And so I would love to see this applied to today's data and if medical professionals and policymakers can um, change that and make things better. And these are my references, and thank you for listening. Please let me know if you have any questions. Thank you.